Let me thank you, Mr. Pallone, for yielding the time, and thank you so very much for your leadership. You do extraordinary work on our committee. Mr. Speaker, I rise today in support of S. 3187, the amended version of the Food and Drug Administration Safety and Innovation Act. I strongly support this bill and particularly pleased that the intent of H.R. 3059, the Creating Hope Act, sponsored by my good friend from Texas, Mr. McCall, and myself, was included in the final bill. I'm thrilled to highlight Section 908, the Rare Pediatric Disease Priority Review Voucher Incentive Program. The program will incentivize pharmaceutical companies to develop new drugs for children with rare pediatric diseases such as childhood cancers and sickle cell disease by expanding the cost-neutral priority review voucher program. Expanding the voucher program will allow pharmaceutical companies to expedite FDA review of more profitable drugs in return for developing treatments for rare pediatric diseases. I think that is a good trade-off. I would like to thank Mr. McCall and Mr. Waxman and Ms. Myrick and all of you who worked on this bill with us. I want to thank our Senate colleagues, Mr. Casey and Mr. Brown, for working diligently with me and our colleagues to see to its inclusion. Finally, I want to recognize Nancy Goodman with Kids vs. Cancer, who continues to be a tireless advocate for this issue. Thank you, Mr. Pallone. Thank you, Mr. Speaker. I yield back the balance of my time.
The gentleman from Michigan.